Okay, so the next thing we're gonna do is we're going to put some dye lube on our dye. We're going to start with the central incisor. Just make sure that the dye spacer is completely dry before you do this. Alright, so if your dye lube is too thick, you can wipe a little bit of it off the dye so it doesn't create space between the wax and the dye, and then we're going to end up with an open margin. So the first step we're going to do is we're going to put a layer of wax over the dye. As you notice, when I'm waxing, I'm kind of trying to flow the wax fairly quickly so that we do not create any laminations. Laminations are basically different parts of the wax up that don't fuse completely, and it will give us a line. Now these lighter areas I'm going to cover individually. Those areas are a little bit too thin, so we want to make sure we cover everything as evenly as possible. Now we also have to make sure that we put hardener on the interproximals of the teeth. After we put dye hardener on the interproximals, then we're going to put lube on it also. This way we make sure that we do not have the wax stick to the interproximals. The first step in our wax up is we're going to try to wax the point angles of the teeth. The point angles create the corners. Generally the way I do this is I heat up the wax, and as I pull the instrument I blow on it, and that cools the wax as I'm pulling the instrument, and it creates those little areas here that will hold the rest of the wax when we start putting on our line angles. These corners are called the point angles because it meets three surfaces. It meets the incisal, it meets the buccal or the lingual, or it meets the distal or the mesial. So three surfaces. For instance, if we're gonna have this point angle here, how do we name it? We name it for where it is. It's the mesio-incisal labial point angle. So I'm going to wax the incisal edge now, and the incisal edge will allow us to determine the length of this tooth. It's allowing us to create the tooth in a very orderly fashion. So we have to think about all the different parts of the tooth. Now we're going to wax the distal line angle. And if you read the anatomy of the incisors, you'll know that the distal portion of the incisors are a little bit more curved. And it curves up here in the incisal 2/3, and then it starts narrowing at the gingival third, and it kind of creates, if you notice, an S curve. It goes like out this way and then in that way, so it's shaped like an S. The mesial line angle is also curved, but not as much, and it's just a simple curve that goes up towards the incisal edge. So the mesial and the distal line angles form the mesial and distal lobes of the central incisor. The third, or actually the fourth anatomical structure, is going to be the gingival portion of the incisor, and this is the area where the height of contour is located. So this area we have to try to match up with the adjacent tooth here. So if we look at it this way from the side, you want to try to match it up a little bit right there. Right now it's a little bit bulbous, but once we start putting in the central lobe, we'll be able to correct that by bringing it down slightly. So this is our central lobe, and it will end at the incisal edge. As we noticed, we did not even touch this wax yet with carvers. We're just building it up. And we have to kind of look at it in all angles to make sure that we are in the right area. Like if we look at it from this area, we can notice that the incisal edge is a lot further in than the incisal edge of the adjacent tooth. So we're going to have to build that up. So we're going to curve it just like the adjacent incisor would be. So we're just going to bring it out. We're not going to make it any longer on this time. So we're just going to try to match up how far that incisor is coming out. So we're looking at it from almost the gingival side as we bring it up. See, as you can see, it's coming out, and now it's starting to look more and more similar to the adjacent tooth. So now we're going to take a look at it from the front, see where we are. As we can see from the top, our incisal edge now is much further out, and we will have to adjust the facial or labial surface. We're just going to bring out our mesial and distal lobes first, and then we're going to fill in the central lobe afterwards. On the bottom here, on the gingival portion, we're not going to add because we don't need to. As we noticed from the side, on the gingival portion, it doesn't really require any additions. We're just probably going to have to carve it down eventually. Now from here in the front, we're going to have to pay attention and try to match up our incisal embrasure. Now what is an embrasure? An embrasure is a V-shaped space that exists in all areas of the tooth: mesial, distal, labial, lingual, incisal, and gingival. So we're trying to match that up. The incisal embrasures will aid us in making sure that that tooth looks very similar in size and shape to the adjacent tooth. Now the embrasures should technically be very symmetrical when we look at it from either the top or the incisal, depending on which embrasure we're concentrating on. So here the tooth is a little bit longer, so we are going to lower it slightly so that it matches the length of the adjacent tooth. So we're more or less finished with the general shape, and we're going to start on the lingual. So in the lingual, we can either start with the mesial or the distal line angles. The mesial and the distal line angles are also the mesial and distal marginal ridges. And these marginal ridges, they go straight down the mesial and the distal portion of the incisor and will run into the cingulum. The cingulum is the bulbous area on the gingivolingual portion of the tooth. So as you notice here, when I'm waxing, making it a little more bulbous on the gingival, and as we come up, we're going to thin it out, and we're also going to make sure that it matches in height with the adjacent tooth here. Then we're going to start the distal portion. You could start on the bottom here, making it a little bit more bulbous, and run it up on the distal portion of the tooth, going thinner and thinner as you go up towards the incisal edge. This one also, we have to make sure that we build it up to the same height or the same level as the lateral incisor. So if we notice here, we just made our distal marginal ridge as well as part of the cingulum. Then we're going to go in to the middle of the tooth here, and we're going to blend everything nicely. We notice here we have a little bit of a wear facet on this tooth, which is the flat area that has been worn away by chewing. So we could actually make the same kind of wear facet on tooth number 9 that we're working on. Then just blend it. Now once we have it mostly waxed up, we can return it to the articulator. And we can just check it out, make sure that our contacts are good. Now sometimes we're not going to achieve a contact depending on how the teeth are situated in the patient's mouth. So now that we pretty much made our lingual portion there, and we have most of our labial, we're going to remove it, and we're going to clean up the interproximals. If you can see it, we have areas that have missing wax, and we're going to make that nice and smooth. After we finish this, we are going to smooth it out with the instrument. We might have to add a little bit depending if we have missing areas. We may have to move the line angles here and there depending on what this tooth looks like when we compare it to the adjacent incisor. We have some areas here that could be a little smoother. So we'll just add a slight amount of wax. A little bit of a missing margin there. We'll add a little more wax there. Now we can take our instrument and gently carve away the margin to make sure that the wax does not go over the margin and it stops exactly at our red line. Over here we got a little bit of a defect, so we'll add some wax. Put it back in the model and let's see what it looks like. So we have pretty much very close to the shape. It looks a tiny bit bigger than the other side, so what we might have to do is bring out this distal corner, this distal line angle, to try to mimic this area here. As we can see, this tooth is a little bit rounded slightly, and we have a slightly straight line angle here that we could possibly mimic on this side. So we're gonna try to mimic this line angle here, and then the distal line angle here. We're gonna have to probably build up a little bit. So if we notice, I'm going to add a little bit here to the distal, making sure that this line angle here is exactly the same or very close to it. And then we're going to try to mimic this little area here, that if you notice, this area is like kind of flat and then it goes in a little bit here. And then if you notice the shadow after this, it also goes down. So we have to try to mimic that in this area. If we notice, now that we kind of shape this down a little bit flatter, these line angles kind of are mimicking each other. Another thing we have to make sure is that this area here, this point angle, is also the same as this point angle as far as the sharpness is concerned. And then we have to also notice the embrasure here. It should be symmetrical so that both of the teeth will look very similar. if we notice here, we have our line angle here slightly moved in towards the center of the tooth, which will allow us to make this tooth look a little narrower, so it will look more similar to that. So here it comes out a little bit, so same thing here. If we need to, we could also measure it, see how far this line angle is from this one, and kind of try to see if we can match it up. So you could use an instrument of some kind, sort of like this, and kind of measure with your fingernail to make sure that it's about the same width, which on this tooth it is. That's why when we look at it, we can kind of see that it's starting to look very similar in size and shape. And there we are. This is pretty much where we need to be. These two teeth should be about the same level, so the tongue doesn't feel any differences in the depression, and it should feel fairly smooth to the other side. Then we'll put it back on the articulator and double check to make sure that our teeth on both sides are touching, so we don't have any areas that are hanging up by the wax, because if the wax is in contact, what's going to happen is when we close it down, the wax up will break. And that is our central incisor.